Ready? All right, so we are going to do chapter 15, Death and Dying. I'm on page 96 in the ring binder, 132 in the textbook. Many of you have heard the name Dr. Elizabeth Kubler-Ross. You may have heard it in some sort of psychology or sociology class, but Dr. Elizabeth Kubler-Ross studied and defined the stages of grief. And what she looked at is what people will experience when there is a loss. And she put it in 5 stages that she has determined through her research and study that each of us will likely go through, not necessarily in the same amount of time, not necessarily in the same order, but that you will experience these stages of grief if you lose something. A lot of the original studies by Kubler-Ross were related to death, specifically death. We now know that these stages of grief are experienced with any type of loss. So if you have a divorce, you will go through the stages of grief. If you lose your home to foreclosure, you will go through the stages of grief. So it's not just applicable to death, but to any loss. The way that I have found it best to do this lecture is to share 3 stories with you of people that I am aware of, familiar with, and share with you how they or their family members got through the stages so that you understand a little bit about what to expect from your clients. The first story that we're going to talk about is the story of Monica Pryor. Monica was a mother who lived here in Greenville County. She had 3 children. Her children were roughly the ages of 1, 4, and 6. It was winter months and she had a persistent cough. And she went to the doctor a couple times and said, oh, this is bronchitis. Let's give you a Z-Pack. You'll be better. And as many of us would do, we'd follow doctor's instructions, take the medication, but she wasn't getting better. And finally, April of that year, she was pretty insistent to the physician that I need you to get a chest x-ray because I've had this cough a long time now. I'm not a smoker. I don't have risk factors. So I just want to know why it won't clear up. So they did a chest x-ray. And they called her and her husband in and said, we have some bad news to tell you. Your chest x-ray shows that you have some tumors in your lungs that are consistent with cancer. We think you have lung cancer. So you can imagine that her first reaction would be, no way. Okay? And that's what they call denial. There's no way I can have cancer. I've never smoked. I've never worked in a factory. I've never been at risk for living in a city with smog or pollution. I'm healthy. I'm young. I think she was 36 at the time of her diagnosis. I have 3 children. There is no way this diagnosis is right. So I want a second opinion. Again, very common that people will ask for that. Physicians understand that. And so she indeed went for a second opinion, and they concurred with the first that indeed she had tumors in her lungs consistent with lung cancer. The decision was made that she would have surgery because they were hopeful they could go in, remove most of the tumorous masses, and then zap her with chemotherapy and radiation, and she would improve and have some longevity of life. They went to surgery, they opened her up. There were so many tumors in her lung fields that in order to remove all of the tumorous tissue, there would not have been enough lung tissue to survive. So they removed what they could, closed her back up, called her in, obviously, when she was going through recovery with her husband, and again said, we don't have good news. We were able to get a lot of the mass out, but we couldn't get it all. You definitely have to have chemo and radiation, and we're giving you probably 6 to 9 months to live. Again, you can imagine the emotions that are going through this. You may still have a little piece of denial. It may not have even sunk in yet. This is what I'm dealing with. But definitely at this point, you've gone to stage 2, which is angry. Who's she angry at?
The doctor.
Oh, she's angry at the first doctor who didn't just do a chest x-ray. But there really wasn't anything negligent about that. Who else is she mad at?
Maybe God.
Probably God if she has a faith. Who else is she mad at? Herself. Yeah. Why didn't I push faster, harder to get the answers? So you go through this anger. You're angry at the technology, that there wasn't a way to take care of this. You're angry at medical science, that we don't have a cure for cancer yet. And so a lot of emotions go into play with that. She started chemotherapy and radiation, and she began experiencing some of the symptoms that you're going to have with chemo and radiation. She felt pretty bad. And she started bargaining. And bargaining is to basically promise somebody you'll do something to take this away. In her case, Monica had a very strong faith, and she shares her story to say that she bargained with God and said, okay, God, if you will get me through this, I will do this, this, and this. I'll raise my children in a Christian home. I'll do everything. I'll be the mother and the role model that I should be. Just spare me this loss. Let my children know their mother. Again, you can imagine as a mother, having 3 small children, 6 years of age and under, you're also again mad at why would I be taken from my children? I was given these children to be their mother and to raise them. Why would I be taken from them? And so she did that bargaining, and her prayer journal was aggressively documented with anything she was willing to do. She wasn't going to complain about the nausea and the vomiting. She was going to try to stay positive. She was going to make something good out of it. She just wanted to survive, as any of us would. Then she got to the next stage, which was depression. And the depression comes about for several things in her story. One, she now feels so bad, she can't be the mother she wants to be. She doesn't have the energy to get out and do the things with her children. She's nauseated, she's vomiting, she's losing her hair, she's gaining weight from the steroids. She doesn't feel good overall, and so she's beginning to experience that depression. Also, the reality is sinking in that I'm probably not going to survive. And how do I manage my feelings of death, leaving my children, leaving my husband? And through the course of time, and this took several months, she realized that the only way that her family could really have the most of her and the best of her was that she had to get to that 5th stage, which is acceptance. Now, acceptance doesn't mean you like it, doesn't mean you agree with it. It means that you've brought yourself to a place emotionally that you understand this is going to happen, and I'm going to make the best of the circumstances that I can. Well, about that time in Greenville County, there was a couple other women that were terminally ill, and they, as well as Monica, had agreed how horrible it was for their kids. But they felt okay. It wasn't their fear of their own death. Even their spouses didn't like it, but it wasn't even that. It was about, I'm leaving 3 small children behind. So they developed a women's group, which now is really termed as a ministry, called Let There Be Mom. So now you've probably seen that word on restaurants occasionally. It'll say, Let There Be Mom, eat at our restaurant, we will donate some. They do it in the spring and in the fall. And Let There Be Mom put together ideas that would leave a legacy for the children of the dying parent. Now again, it was designed by 3 women, so it's called Let There Be Mom, but dads are also now included in the ministry. They went to recording studios and asked recording studios to donate recording time so that if they played the piano or they sang, or in Monica's case she played the violin, they could make recordings for their children when they were deceased. They went to photo studios and asked for sitting times. I want a picture with each of my children, very special pictures for them to have once I'm deceased. They went to travel agencies, and very much like Make-A-Wish, asked travel agencies, will you donate a trip for us to take our kids to Disney? Now it's not about the child's Make-A-Wish, it's the parents' wish to have that time with them. They came up with, through a jeweler, a gold thumbprint, where the mother would put her thumbprint in gold and make a necklace for their daughters to wear around their neck, so they would be close to their mother's heart, or the mother would be close to their heart. So a lot of good came out of that. You can go to their website. They actually share the story of everybody who has joined the organization. Obviously, these are people that are all dying, so the stories are sad. But the idea was they needed a way to get to acceptance, and that allowed her to be more accepting of the outcome because she knew what she was able to leave for her kids. She actually ended up living 18 months. She was diagnosed in April, and she died the following October. So she did end up with more time than she was given initially. I happen to know Monica because she went to our church. That's why I know the story a little more intimately. And shortly before she passed, she actually sang in church, or she didn't sing, she played the violin, and one of our singers sang, and they did the song, the Tim McGraw song, Live Till I'm Dying, or Live Like I'm Dying. Oh my gosh, with everybody sobbing in church. But she really was there. She was there understanding that, this is going to happen, and I need to make the best of it for my children in the best circumstances. So that's the story of Monica, and again, if you want to read more about her, you can go to the website or any of those and look her up. So those were her stages of grief that she went through. Now the second story is the story of my father's death. And we're going to go through the stages again by way of a story and see how it happens a little differently when you're the one being told somebody has passed. You're not the one receiving the news for yourself. So my dad was 75, actually 74 technically when we went to the doctor's appointment. Very healthy, was still water skiing, still playing tennis, but he was getting winded. And so he said, Karen, let's go see a cardiologist and make sure everything's okay. We did, and the cardiologist said, well, it looks like you have a mitral valve that's a little bit leaky. And we could go in there and either replace or repair that valve, and I think you'd be good as new, and you could get out there on the tennis court and still ski, and my dad was in very good shape. So we scheduled the surgery. It was scheduled for June 24th, 2005. And I said to my dad, why are you doing this on your birthday? It was his 75th birthday. And he said, well, what better day to do that? I'm either going to get a new valve or I'm going to go meet the Lord. And I said, Dad, don't even talk that way. He's like, I'm cool with this. Let's do it. So we scheduled it for his birthday. And a couple days before his birthday, we had to check in the hospital, and they get you all prepped and ready for surgery. And the night before surgery, they came in the room and said, we're going to have to cancel surgery tomorrow. And of course, emotionally, my dad was prepared for this. We were all ready for it. And I said, why are we canceling it? They said, well, we didn't stop one of his blood thinning drugs early enough, and we think his bleeding time is a little bit too much, and we would like to settle that down, so we'd like to let you go home for the weekend, come back on Monday, and we'll do the schedule to do the surgery Tuesday morning. We weren't really excited about it, but he was getting to come home, and so I suggested to my dad and my mom, they lived in Hendersonville at the time, I said, just stay at our place this weekend, we'll spend some time together, we'll go ahead and celebrate Dad's birthday, and we'll get him back to the hospital on Monday. So we left Friday afternoon from the hospital. I took my dad to Gus's on White Horse Road. It's a meat and three kind of restaurant. We had dinner. Spent the night at my house. Saturday we got up and he took the grandkids to Chuck E. Cheese. And then we went to see the movie Bewitched that night. Sunday morning we got up and went to church together as a family. And Sunday afternoon had a big cookout in our backyard. And I had all the grandkids and my brother and his wife and so forth. Monday morning, we packed up, headed towards the hospital, and my dad said, can you stop at CompUSA so I can buy a computer? And I said, Dad, we are not stopping shopping right now. We're trying to get you to the hospital. He said, no. He said, I do everything on computer, and I've never taught your mom how to do these bills or anything, and I've just been worrying about it, and I just want to make sure I get an upgraded computer. I went along with it. We stopped by CompUSA. He picked out a computer. We loaded it in the back of my van, and we headed to the hospital. Got him all settled in. Doctor came around, said, we're good to go. Surgery's at 2 o'clock tomorrow. So my mom and I left that night, and I said, Dad, we'll be back in the morning. We'll sit with you before surgery and spend some time together. Tuesday morning, the phone rings. It's my dad. He said, Karen, they're taking me to surgery right now. And I said, no, Dad, it's 9 o'clock. You're not scheduled till 2. Don't get on the stretcher. Let me find out what's going on. So I called the ward secretary, and I said, what's up? My dad says someone's in the room to take him to surgery, and he's not scheduled until 2. And they said, well, there's been some change, and they can take him now, and nothing's wrong, but they'd like to go ahead and take him. So I called my dad back in the room, and I said, Dad, nothing's wrong, but apparently a room opened up, and they'd like to go ahead and take you. I said, Mom and I are getting ready, we're just not there yet. And he said, we're good. He said, let me go ahead and get this done, and I'll see you later. So I spent a few minutes with prayer on the phone with my dad and told him I loved him. Gave the phone to my mom, who had the opportunity to do the same thing. And I started driving to the hospital. I can't tell you why, other than the fact that Kubler-Ross is brilliant. But I went straight to bargaining as I was driving to the hospital. I don't know why. There was nothing at this point that was a red flag to anything other than I just didn't feel right. And this was my bargaining. I said, okay, God, this isn't feeling real good right now, and so I'm going to ask you just for one favor. If you are planning to take my dad, I want you to let him get through surgery, get to the ICU, then let us all see him, and then if you have to take him with a blood clot or some infection or something, I'll be okay. I won't really like it, but just don't let him die when we're not seeing him this morning. It was just the strangest feeling, and all the way to Memorial, I'm saying just let him get through surgery, let him get to the ICU, let us all get there. And so we get to the hospital, go up to the waiting room, and in the waiting room is a dear friend of mine. His name's Dr. Ryan Hoffman. I don't think he was a doctor yet. And I said, Ryan, what are you doing here? And he said, well, my mom was supposed to have valve surgery this morning. They accidentally cannulated her carotid artery instead of her carotid vein, so they've postponed her surgery to tomorrow. And I laughed and I said, well, I guess my dad got your mom's room, which really is what happened. And we're kind of just chuckling about it. And about that time, a nurse came out and said, Harris family. I'm like, we're right here. And they said, can you come here? And they took us in the family room. And my mom gasped and she went, oh, something's happened. And I said, oh no, Mom. They could hardly even be started with the case. There's no way anything could have happened. That waiting room is just so busy, they just wanted to separate us out because it's a long procedure and that way they can talk to us. Now, I had been an ER nurse at that point for 25 years. You do not go to the family room for good news. Might not be death, but you don't go for good news. But yet I sat there convincing myself, oh, we're good, everything's fine. A couple minutes later, the nurse comes in and says, oh, I'm so glad I moved you into this room. Your dad's bleeding heavily. They're trying to get it stopped. It's looking very bad. You know, just stay right here. We'll keep you posted. And then within a few minutes, the surgeon came in. And he was about as white as his lab coat. And he sat down and he said, Karen, he said, we lost your father on the table. And he said, we were opening him up, and suddenly we just had blood pouring out of his chest, and we couldn't figure it out. And he said, you know, we put him on bypass, we started CPR, and his pressure went from normal to about 60 in a minute, and within another minute we had lost him. And he said, once I saw that I couldn't resuscitate him, I finished opening him up and found out that his aorta had grown to his sternum. So about that much of his aorta had grown to his breastbone. Okay? So the aorta, remember on the blood pressure day we learned that the aorta came up and arched down and went right down the center of the body? Mm-hmm. Well, for whatever reason, he had gotten this adhesion and had grown to it. So when they sawed through his sternum, which is a common procedure, they sawed right through his aorta. And every time your heart pumps, it ejects about 2 ounces, 60 cc's of blood, takes about 100 beats of the heart, and you're just exsanguinating out on the floor, and he was gone. I was angry, and I was like, I just can't believe this, I just can't believe this. And he said, you know, I am so sorry. You know, family employees are family to me. I mean, I take care of everybody well, but you're family. And I said, that's not what I'm mad about. And he said, what are you mad about? And I said, I'm mad because you changed the surgery for your convenience, and we didn't get here to see him, and now he's gone. And the surgeon did not know that. He said, I was just told that the case was ready early, and I came, and I had no idea that you all had not seen him, and I'm so sorry. And so, for whatever reason, that was where my displaced anger was at that moment. As we started coordinating everything to head back up to Hendersonville, I was pretty mad at God. Pretty angry. And I said, okay, I thought we had a deal. All I asked for him to survive through surgery to the ICU. You could have taken him, but now nobody's seeing him. I was feeling a bit of depression because I had picked the surgeon, I had picked the hospital, the family trusted my judgment as a healthcare, and the only healthcare person in the family at that time. And I felt like I'd failed them, so some of my anger was a depressive anger as well. And I was mad. I mean, I was really, really angry. And just ever so peacefully, a calm came over me. And you know, some people believe in some sort of spirit or sense of being spoken to. But this is what came within me. Karen, I gave you Friday night dinner, Saturday night with grandkids, a movie Saturday night, church on Sunday, a cookout Sunday afternoon, shopping on Monday, and the very last thing that you got with your dad was a prayer and an I love you. And you're mad because I didn't let him wake up from surgery in pain with chest tubes running out of his chest for you to have a few more minutes? This wasn't about you. This was about him. And it was an amazing sense of calm. And then kind of a little explanation point that was then. And remember, I changed the surgery from the 24th, so your dad didn't die on Corey's birthday, because Corey shared my dad's birthday. He was born on June 24th. And so it was like, okay, I mean, I've got to get to acceptance, because I can sit here and waller and being mad, and I can be depressed, and I can be overwhelmed, and I can not be able to work and provide for my family, or I can look at everything positive that happened through that process, as horrible as it was, and try to have some level of acceptance. So again, my depressive phase wasn't long at all, and I actually was able to share the story that I just shared with you, not as much detail, at his funeral service. That, you know, this wasn't about my way of wanting my dad to go. It wasn't about what was most comfortable for me. My dad didn't suffer at all. He was laughing with the anesthesiologist, went to sleep, and he never suffered. And so I have to look at those positive elements. Now, having that happen, we had the death certificate arrive a few weeks later. And it said, cause of death, natural. You can imagine I was pretty angry again. And I'm thinking, why would they have done this? This was an accidental death. This was not a natural death. So I wrote over to the coroner's office, who's a friend of mine, and I said, can we please get this changed? My mom's insurance is impacted by it. It needs to be listed as an accidental death. I know it was an accident, but we need to get this changed. And he said, well, let me check on it. Sit here and I'll check. And he's gone for a while, and he comes back, and he sits down, and he said, Karen, your father's death was never reported to our office.
Wow.
So now I'm really getting my feathers like in a stir, thinking, why wouldn't they have? I mean, we're human. We make accidents. We are not perfect. We make mistakes. I'm a very forgiving kind of person, but you start having the sense that somebody was hiding something. My mom was struggling through these stages of grief, and so she said, Karen, get me the medical record. And I said, I will, and you may do what you need to do, but I can't do anything. One, it's my employer. I need to work for the next 15 or 20 years for this employer. I will not be a party to this, but I will get you the information you need so you can make a decision about what you want to do. And was able to do that. For me, I still needed to do something because it just wasn't right. And so I asked to meet with administrators and directors of nursing for the different departments. And I met with them and I said, I'm going to ask you guys to put in place the John B. Harris provision. That's my dad's name. And I said, I would like this provision to be in place that says, if you're changing surgery for the convenience of the operating room, the family will be notified, given 1 hour to come see their family member before they will be in surgery. And as you can imagine, they were very willing to embrace that idea. Oh yes, we'll do this, we'll do this. But I never thought I'd get to know whether they did it or not. And just a year ago, sitting in this seat right here was a young lady named Alicia, listening to the same lecture. And she raised her hand with tears in her eyes and she said, your dad's provision is in place. And I said, how do you know? She said, my uncle, they had to change his surgery. And they called us and said, we have an hour to get there because of the schedule change. And we went and saw him. She said, and to top it all off, he died in surgery. And so, again, I wasn't going to know, but that kept forcing me into acceptance, forcing me into this is okay. Now, my mom didn't get there that fast.
That happened with my grandma.
Really?
But she didn't die.
But you did get that time?
They called us at like 5 o'clock in the morning and they were like, you have an hour to get here, we don't think she's gonna make it.
Oh.
Yeah.
Yeah.
So those are things that help me still to, because I can tell you, it's been 10 years. And any of you have experienced a loss, you will go back on the anniversary dates, on birthdays, and be sad and remember things and get angry. But the bottom line is Kubler-Ross says, spend the majority of your time in acceptance. Get there and spend most of your head time in acceptance.
When I read this, it reminded me of my work with the funeral home for 2 years.
Oh, yeah.
And the funeral director, Thomas Lynch, said to me, Dan, you wouldn't believe the anger that I deal with. People take it out on me.
Right.
And he is professional and he's able to handle it. He knows that it could happen. But when I read these, I thought of him, that statement he made to me too about death.
Yeah.
And how.
And they're going to see those because they're early on dealing with the family, the mortuary, and,
Yes.
and those, they're very early on dealing with it. So they're going to see that. Just to kind of finish that piece of the story, my mom did for almost 3 years look into it very, very closely. And what ended up being determined is on that Monday that he was admitted, they had done a CAT scan of his chest. And you do that before heart surgery to make sure everything is structurally normal. It's a routine. It's like coming in the hospital and getting lab work done. And for whatever reason, the radiologist thought it was a chest x-ray like looking for pneumonia, like chest x-ray for pneumonia, wasn't looking at it as a pre-surgical reading. And so he didn't look nor see the aorta grown to the sternum. And then the films are actually supposed to be up in a view box in surgery so that they can, last minute, let's look at it, make sure everything's right before we go into it. Again, I'll never know for sure, but from the deposition, basically it appears that nobody knew that before it happened. Had they known, they wouldn't have done the surgery. This was an elective procedure. They would have said, listen, he's got this weird adhesion, and if we open him, he's gonna die, so I hate that your water skiing and tennis isn't gonna be what you want it to be, but at least you're alive. That would have been the difference in the outcome. So my mom did file charges. The formula that I showed you in chapter 2 with the amount was the exact formula of my dad. He was valued at $480,000. Again, that's the maximum you're gonna get based on my dad's scenario. And nobody ever wants to give you the max. And then of course your attorney's gonna get a huge chunk of it. Most attorneys get at least 40% of that. My only real reason for supporting my mom through it, 2 reasons for supporting my mom through it. One, I think she needed that to get to acceptance. But secondly, they were not willing to change the death certificate, and it impacted my dad's life insurance policy because it's a much higher pay for an accidental death than natural causes. And I just needed to be sure my mom would be okay financially and be provided for. And she was successful in her litigation. And they did a pre-trial negotiation and was successful in compensating herself. Yeah.
With you being a professional and a registered nurse and a medic, can you honestly or safely say that you never worked with a doctor who was negligent and you knew it?
Yeah, I think when you practice in any arena of healthcare, I don't even care if it's in a doctor's office. If you are practicing with people in healthcare, you are going to see people make decisions that are negligent. It means they had a duty to do something and they breached that duty, okay? They didn't do what they should have done. I think for a couple of years, and this is a little bit of a side note, but we started getting all wigged out about MRSA, and we were culturing all these people, and then finally, people were going to the doctor with MRSA symptoms, and they were saying this is a staph infection. They weren't culturing it, and they were just treating it so that MRSA wouldn't be on your chart. I think that was a means of neglect. I mean, why was the standard of care to culture everything prior, and then all of a sudden when it's this big issue for insurance and healthcare, we no longer do that. So to answer your question, I do think that happens. I also understand that everybody's human. And if we go back for just a minute to my Mrs. Jones story of the nursing home, of the lady who fell, I could take that same scenario. Jamie was the CNA, she put Miss Jones to bed, she put the bed alarm on, she checked it for functionality and it was working normally. Miss Jones tries to crawl out of the bed, and nobody's right there in the room. You hear the alarm. Somebody tries to get there when they hear the alarm. By the time they get there, she's in the floor and the accident has happened. That's not negligence. That's the difference between negligence and an accident. She still may die. But I had to have shown that there was a causal relationship, and in that case, there wasn't. In the flip of that, she did her job. We tried to get there. I mean, if you're changing a brief, even in her roommate's room, trying to jump over there really quickly to keep somebody from falling is almost impossible, but you at least didn't breach your duty, and that's what changes that. So absolutely, it goes on. The third story I'd like to share with you is the story of one of our phlebotomists from the Greenville Hospital System. And she was on her way home from work one day. She's 26, very attractive. She was a runner. And there was an accident that had occurred on 85 just before she came up on it. And she decided to be the Good Samaritan and help. So she pulled her car over and went to check on the individuals. And somebody not paying attention hit her and pinned her between their car and the car of the person she was trying to help. And the bumper, as you can imagine, on an average height person, is going to hit you about the level of the knees. And when she got to the trauma bay at Memorial, her legs were basically dangling. I mean, there was virtually no sense of thinking that her legs were going to be viable. And so as they were talking to her in the trauma bay, they said to her, we've got to get to surgery. We're going to have to remove your legs. We need you to sign a consent. And she couldn't stay here long, but she was in pretty much denial. No, you're not going to take my legs off. We see stories in the news or 60 minutes or 48 hours of somebody who had a limb reattached and, don't tell me you can't do this. This is a level 1 trauma center. if you can't do it, send me somewhere else. And that was the emotions going on with her. And they said, we don't have an option. It looks very, very bad. They did even send, I believe, her films to Emory or Grady in Atlanta, just to kind of get a sense of somebody else's opinion. And so she, realizes she really doesn't have any choice. To help her through that, we had her sign a consent that said, irrigation and debridement of both lower extremities, attachment attempted, amputation if needed. That way, she knew we were going in with the insightfulness that we would do what we could, but if we couldn't, we didn't have to wake her up to get permission to remove her legs. So she goes to surgery. She comes out of surgery, one leg on, one leg off. Now she's angry. Who is she angry with?
The doctor.
The doctor, yep. She's mad that the doctor couldn't get both legs back on. Who else is she angry at? The car, the driver of that car that wasn't paying attention. Herself for stopping. If I had just gone on and not worried about it, this wouldn't have happened. Again, depending on her faith, whether she had an anger with a higher power. But she went through that. And then she went through bargaining. And her bargaining was bargaining with the care to save her other leg. So her bargaining was telling the surgeons, I won't complain if you have to do multiple surgeries, if you have to do a skin graft, if I have to stay in the hospital for 6 months, I'll do therapy, I'll never complain. Just keep saving the leg you saved. Because at least with one leg, I feel like I have some normalcy. If I lose that one, I got nothing. So a lot of her bargaining was kind of like, I'll behave if you save my leg, which clearly was not about saving it, but that's where she was in terms of her emotion. The leg actually stayed attached for a long enough period of time that she was ready to go to rehab. I believe they sent her to Shepherd's down in Georgia, and she got pretty depressed. As you can imagine, now you're learning to walk with a prosthetic. You're learning to look at a very disfigured, ugly other leg, which clearly they got it attached, but it wasn't normal. You're 26, you're single, you're a runner. You know all of that has changed. Those are women understand the self-image that we would feel like nobody could love our disfigured self, we wouldn't be lovable. So she had a lot of depression over that. I don't know what brought her out of that, and I would love to learn that part of the story one day. But I feel certain that she made it because she came back to work as a phlebotomist at the hospital. She had a beautiful prosthetic. Of course, the hospital had a parking space for her, an employee, a wheelchair, a handicapped parking space for her designated. But she came back to work and she moved on with her life. So she had to have had something occur that made her get to that point. Now, my reason for sharing these 3 stories with you is not to have people get teared up or dig up things that you have had to deal with. But I want you to understand that Kubler-Ross's stages are very real no matter what the scenario is. Whether you're told you're dying, whether the person has already passed, or whether you've just suffered loss with no death, you're still going to go through that. Again, she'll say it can jump around, you can go back and forth, you can stay in stages for a long period of time. I had a student one time, an older lady who had come back to school, she was in her 60s, and the day I did the lecture, she raised her hand and she said, people stay in depression a very long time sometimes. I said, absolutely they do. There's people that many times don't get past that. There's people that have committed suicide over the loss of somebody because they couldn't get out of depression. And she said, today is the 12-year anniversary of the loss of my husband in a car accident. She said, I've been stuck in that stage, and I'm in class to move on. And again, so we don't realize what people are going through when they've suffered the loss and how long they've had to stay in a stage of healing. You all then will experience the family members and their reactions. Again, if you're around when they're being told, no, there's no way, this can't happen, the anger depending on the circumstances. If they're deceased, the bargaining's kind of tough, but depression and acceptance and how you handle them. The best thing I can tell you is that everybody grieves differently. Some people grieve quietly, some people scream, some people punch walls, some people fall on the floor, they pass out. Everyone grieves differently, and you can't point and say, well, that wasn't the right way or that was a different way. You just need to be there. Have a chair ready if you're going to be around when they learn it. Have a box of tissue around if you're going to be close by when they learn about it. You should not be the one telling them. You're not the one calling the family member saying, as a CNA, I was taking care of your dad and they passed. But you could be a part of that family member coming to learn about that or experience that. You could be asked to do something called post-mortem care. Post means after, mortem means death. Many times when these elderly patients pass away, they are incontinent right near the end of urine or stool. So cleaning them up, as horrible as that sounds, I'm cleaning up a dead body. Yes, you are. You want to get them cleaned up. If they've, thrown up or have something on their gown, you want a fresh gown on. If somebody's coming to see them, brush their hair. I know that sounds crazy. If they have dentures, put them in so that their mouth isn't sunk in. They have a more normalcy, because most people want to see their family member. So we usually position them with their head of the bed up in little fowlers. We put a sheet on, they're all cleaned up, we brush their hair, we have one arm out where they can touch them, they can kiss them, they can do whatever they need to do, a chair and Kleenex, and then offering them, do you want privacy, or would you like me to just stand here? Again, some of them don't want to be in a room with a dead body, and some just need time. And you need to honor that, because that's how they're starting that grieving process. And if we don't honor what they think they need to get through that, they're going to struggle to get to acceptance. So honor those requests when you do postmortem care. On the state exam, the questions that have been on the state exam previously have either been about the stages of grief in a scenario format. So for example, Mr. Jones has been told he has 3 months to live due to his cancer. It is January and he's asking you to help him with his shopping list for Christmas. What stage is he in? Now that's denial. He thinks he's going to be alive at Christmas. Or your resident asks you to write down the songs you would like for your funeral and who you would like to speak at your funeral. What stage are they in? And clearly they're in acceptance. So that could be a question. The other one is the postmortem. They have used that word on the test before and said, which of the following items could you be asked to do with postmortem care? And those are listed for you on page 133 in the book. Hearing's the last sense to go, so as they are dying, be careful what you do say. You say, well, how do you know hearing's last if they died? You can't ask them after that. There have been enough cases of people who have died, gone into cardiac arrest, been resuscitated, and can repeat things they heard in that death process. So just know that hearing is the last sense to go. And we do encourage family members to speak, talk, say I love you, do what they need to do. All right, let me share one other scenario with you, and then we'll wrap up chapter 15. But early on in my nursing career is when really we began to understand more about families' need to see either a dying individual or somebody who's passed. That really wasn't the trend 30 years ago. And we had a situation where there was a toddler who was in his car seat, and mom had pulled up to the gas station, and she was pumping gas, and he had managed to get out of his car seat, come over the driver's seat, and he knocked the car into gear. And as he did, he toppled out of the car, and the back tire rolled onto his chest. So when EMS got there, he was in traumatic arrest. Got to the trauma bay, they were doing CPR. That type of injury usually means that you've damaged one of the pulmonary vessels or the lungs or the heart. And so in that scenario, particularly if you're a young person, not if you're 90, but if you're a young person, we are going to crack your chest. We're going to open it, we're going to put spreaders in. The doctor's going to put their hand in and provide the heart compression till they can quickly look and see, is there anything that could be repaired? And then usually you run off to surgery, literally, with your chest spread open, with the doctor's hand in there doing cardiac massage, on the hope that you can get in there and repair it. Again, these TV shows with Code Black and some of the different ones, they've shown some of those sometimes. So we got the child in, we cracked the child's chest, we had spreaders, doctor's hands in there, they're trying to figure it out. And the mother says, I want to see him before he goes to surgery. Because they had already brought the mother to the family room, he's very critical, he's hemorrhaging, they're doing CPR, we're going to try to get to the operating room. And she wanted to see him. And I was pretty mortified. I mean, the nurse kind of put her head around the trauma bay and said, the mom wants to see him before you go, can she? And I was like, no, in my mind, no, I wasn't the charge nurse, but no. And the doctor said, yeah, just give me a second. And I thought, oh my gosh, this mother, she's not going to be able to handle the image of this chest spread open and the spreaders and the blood and his hand and the heart. And this doctor made a TP with the sheet. and got everything situated with the little child's hand out. He stayed on the other side, stayed on the child's left side, with his hand in there doing cardiac massage, and said, send the mother in. And the mother wasn't focused on the graphics of what she was seeing, or what we were doing, or whether we were doing it right. She was focused on, let me get to his face, and see his face, and talk to him, and kiss him, and tell him I'm sorry before he goes surgery. So everybody thinks it's about, I don't want him to come in and see what we're doing. They could care less at that point. In her mind, even though we knew he was in cardiac arrest, he was still alive to her. And so to be able to touch him and hold him, or not hold him, but touch him for a moment and kiss him was very beneficial, to the point that she wrote us a letter about 6 weeks later and thanked us for the time. He died in surgery. And thanked us for the time that she got with him in his last minutes. In our mind, we wouldn't have valued that as quality, but in her mind, it was very, very valuable to her. So don't, again, question sometimes what people want to do. We've had parents want to lay in the bed beside a child who's deceased. There's now a huge trend with babies who are born deceased to do these videos and these picture collages. It's just incredible. All of that in an attempt to help people get to the best place they can be, which is acceptance. All right, before I answer Q's question, any questions about the 5 stages, post-mortem, some of the things that you might be asked to do? Awesome. That is chapter 15, and we're done. Now,